So you've taken this insight that you had from your own healing,
Yes.
and you've done an extraordinary thing, which is you've created a model that you use to treat patients
Yes.
and to train other physicians and
Yes. Yes.
providers and to do research in this space. And you were at the VA in Iowa and had done amazing work with people who had very little resources, not a ton of money, couldn't do a ton of testing.
Yeah.
And, people think functional medicine is always all about testing, it's all about supplements, but you really were able to show that it really is primarily food and lifestyle and just a few basic things that
Very
can make
basic.
a huge difference. So tell us about what you learned
Yeah,
in that process.
So I had my personal transformation, and then I started talking about food and exposures. I changed how I practice medicine in my traumatic brain injury clinic. I'm really focused in on diet and lifestyle, and I have to deal with physician complaints because I'm not practicing like my colleagues. So I had to meet with my chief of staff, go over what I was doing and why, bring down my papers, and get some coaching on how to document in the medical record so I could pass peer review and make sure everybody was comfortable with what I was doing. Happy. So we got that.
God forbid you're telling people to eat better.
Yeah. So I got that down. And then because I was having such great results, the chief of medicine came in and told me he was pulling me out of primary care. And would I open up a clinic where I could practice the way I wanted to practice? And I said, no, I won't do that. And here's why I'm refusing. You need to get endorsement by the chief of staff and the director of the hospital, because we just want to be sure that they know what I'm going to do and that they approve
They're
of this.
behind it, yeah.
And so I thought that was probably going to be the end of it. 2 weeks later, he came back and he said, I have the endorsements. We're good.
That's so great.
So we got the endorsements going, and then we decided that we'd call it the Therapeutic Lifestyle Clinic. So it was very clear to my referring physicians and to the patients that this was all about diet and lifestyle, that I'm not prescribing drugs.
And diet and lifestyle as treatment, not just
as treatment.
prevention, like
As
therapeutic
treatment. It was
lifestyle.
therapeutic. And you could come, you had to be referred in by a physician, could be for a mental health problem, medical problem. So we saw people from all sorts of issues. I met with primary care and the subspecialty clinics and said, give me your most ill people who are willing to use a therapeutic diet and lifestyle. I'm using no drugs. It's just going to be diet and lifestyle. We did this through a series of group classes. The first class was, here's my story, here's the concepts of the therapeutic lifestyle. We talked about functional medicine, integrative medicine, diet, lifestyle, detox, mitochondria, all of that stuff. And then I invited people to either just go back to the doc and say, this is too hard, or I'll work gradually on my diet and then meet with the dietitians, or if they would commit to being gluten-free 100%, lots of vegetables for 100 days, they could come work with me. We'd have a group intake where I'd meet with them for 2 weeks as a group to sort of do their timeline of their health experiences. And then they would meet with the dietitian for 2 hours, who would have a cooking class and help them reimagine breakfast and lunch and reimagine the relationship with food.
Very practical.
And then we would see them once a week for skills class. As many people as could fit in the room could come get the skills classes. And we'd have a support group of 6 to 22 people at a time that we'd see every other month.